My name is Lena Sharp. I'm a cancer nurse and I'm the president-elect of EONS, which means that I'm going to be the president in a year from now. Well, the nursing handover sessions is an overlooked process, I think, in nursing. It's something we just take for granted. But there's a lot of research today showing that how that is being performed actually impacts the experience for the patient and also the result of the care. So we need to systemize the handover sessions and look at the content and see what we're doing there, because there's so much to be gained. In some parts of literature, it's described as a very severe safety risk, because if the communication doesn't work in the handover, that's a source of a lot of medical errors. Well, I'm a researcher, and we've been comparing the standard procedure for nursing handover, which means that the nurses sit on the nurse's office and read up on their patients, or sit and talk to each other on the nurses' stations. But we compare that standard procedure with the bedside version, where you include the patient and the family members in the handover process. And the results we have from some of the studies are still ongoing, but some of the results showing that patients pick up on this, and so they're more satisfied with the information they get, and they actually notice a difference. So even if this handover is only 5 minutes a day, because that's the fact, we see improvements on the patient experience if it's done at bedside and include the patient. And the key is not the bedside itself is not the issue, it's to include the patient and the family members. So the place is just one part of it. It's to include patients and family members in the handover process. The implications is that we can get really great benefits for both patients and nurses. The patient can have a better quality of care, they can be more involved in their care, which means safer care. If they know more about what's happening to them and what medications they're on, and if they can on a regular basis have a dialogue with a qualified nurse about that will improve the safety for them. So, and also for the nurses, because they feel they have better control over their work. Instead of reading the hospital files, they see firsthand on a daily basis in a systematic way. They speak to each patient that they are responsible for. Yeah. It's actually a way of being very structured, and also include the individual needs. So you're both very square in the setting, but also include the individual needs of each patient. So it's a combination of those two. EONS 10 has been a great success for us. We have 550 delegates, which is enormous for a cancer conference or for cancer nursing conference. So that is great. And we get all kinds of positive feedback. We are big into social media, so we see mainly on Twitter. And we see it's interesting to follow the feeds during the sessions. And I can say a difference from this conference is different in many ways. It's bigger than many of our others, but it's also more interactive. And the discussions after each session have been on a very high level. Great interactions, and lots of questions and dialogue. So it's definitely an arena for networking. And I think that I get a very positive vibe from the delegates I talk to, and hopefully we can continue this independent conferences in the future as well. So we both need to have the conferences when we meet with the other professional group, because we all work in teams, but it's also important to have sessions or conferences for our own group to develop our own practice. So I think both is really important. Well, the future is to do both, as I said, to both have the large conferences together with the other professional groups, but also to continue our own meetings. And the project we're working on, which is our big flagship for the next coming 3 years, it's what we call RECAN, recognizing European cancer nursing, and that's we were in the middle of phase 1 of that project now, and that's collecting data that's been published, and we're doing a systematic review of that data that's going to be presented on our next conference in January. And phase 2, which starts next year, is to go to different countries where cancer nurses have different conditions and collect data and interact with those nurses and stakeholders in different countries. That's going to take most of our next year. And then the year after, we're going to use the data from phase 1 and 2 and try to impact on a European level, because cancer nursing as a speciality is not recognized in probably half of the European countries, which have a big impact. So what we're seeing in those countries is that nurses without specialist training are delivering serious, dangerous drugs that they're not qualified to do in some of the cases, and they're not educated to give the special support that cancer patients and their families needs. So it's a big need to recognize cancer nurses in a better way. So that's what we will do for the next 3 years, and we're very excited of that big project. I'm looking forward to being the president. I've worked with EONS for 4 years already, and I love working on an international arena. And to meet colleagues is the thing that I value most. We have so different conditions, but we have so much in common as well. And that's what I get to do, meet nurses from Slovenia and Estonia and Spain and Portugal and all the other countries on a regular basis. It's fantastic, and that's sort of we can impact so much together on your regular daily work. Of course you can as well, but you're more restricted there. In this sort of organization, you have such a possibility to impact together, and that's really what I think is excellent with this work.